Welcome everybody back to GoLocal Live. I'm Josh Fenton, CEO and co-founder. I'm joined by Dr. Michael Fine, former Rhode Island Director of Health. This is sort of a special edition based on some new data that was released by the CDC with Rhode Island health officials. Dr. Fine, give us an overview of what we learned this afternoon on a 1 o'clock press conference.
Sure. Well, you know, the most important thing is that this was the director of CDC talking about work done in Rhode Island, and very complimentary about the work done by the Rhode Island Department of Health, in particular, Amanda Della Grotta, Dr. Alice Klein, Christine Campagna, and Dr. Bandy, the state epidemiologist, who worked on this study with CDC. And what the study, this is called the MMWR, the Weekly Morbidity and Mortality, or the Morbidity and Mortality Weekly Report, which is kind of the center of all public health moment by moment. And this report was a study of 666 childcare programs that were allowed to reopen after June 1st until July 31st, and showed fairly limited, what's called secondary transmission of cases inside those child cares. It showed, or appears, or CDC believes, suggests, or believes that it showed that when people are in child care in the right circumstances, with very strict rules, that when a kid comes in, or when somebody comes in with COVID-19, there isn't much transmission to other people. Okay. There is some, but not much.
And Dr. Redfield was on this call, the top man at the CDC. And what are they, I'm sure they're interested in every state, in every study, but why is this one so important?
Well, I think in part because it was well done, and in part because it was the first. This is the first CDC study that I'm aware of that looks at, you know, childcare and, by analogy, perhaps schools, and what happens when you bring people together. But remember, there were strict rules, and those strict rules were things like the childcare had a reduced enrollment. They started with only 12 people in a group. They went up to 20, but no more than 20. They required universal use of masks for adults. They required daily symptom screening of adults and children, as well as enhanced cleaning and disinfection. So you had to stick to those rules if you were going to open. And there was enforcement. There was somebody from the Department of Human Services who inspected 100 or 150 of those child cares during the course of those 2 months. So there were both rules and enforcement, and they were strict rules. And under those rules, they found 101 possible cases of COVID. They ended up confirming or thinking probable that about half of those, or 52, were probable cases, but they then didn't see very much transmission. I think they saw what they were certain of transmission was only in 4 of the 666 child cares. I think it was only 4 out of that, very small numbers indeed. Though remember that the observation period was quite small, that we were just talking about 2 months. And so we don't, and it was a period when community transmission in Rhode Island was as low as it's been since the start of the pandemic.
And what's the age group of the children that were tracked during this 2-month period?
I do not recall that specifically, but it was obviously, these are childcare programs, so typically they're kids less than 5.
Right, so infants to 5-year-olds.
That would be my guess.
They are not out in the parking lot after school joining together and going for a ride to the fast food restaurant as high school students would be doing.
Exactly. These are small little kids, I think, and they were very strictly supervised.
And what was Dr. Redfield's takeaway from this study, besides appreciating Rhode Island's quality of work? But what's the learning that CDC is taking away? Listen, this thing was at 1 o'clock. I get hit by 2 or 3 people around the country with emails flagging this analysis. What's the White House, what's the CDC, and what's the State House going to do with this data?
Well, I think what they're saying is, and what Dr. Redfield said specifically, is that there's this is a way to tell the public that there is a pathway to opening at least childcare. And I think by analogy, I think they are hoping people will be encouraged and teachers will feel confident about their about the limited risk of transmission. That's the take home, I think, was that there are pathways to doing this and doing it right and doing it successfully. But, you know, Dr. Redfield emphasized a number of times that this requires places where there is very limited community transmission, that places where there are high levels of disease need a whole different approach. And so Dr. Redfield was very clear that everybody needed to employ the mitigation steps recommended by CDC, by which I think he meant masking and social distancing, and some of the hand washing and some of the other things that are in the CDC report. I mean, I think that the take home was there is a pathway, but it's a pretty narrow pathway that requires strict adherence.
Listen, we saw in Georgia where there was high level of community spread, when they opened up the schools, especially the high schools, all best practices went out the window, and those schools were closed, you know, shortly thereafter, with a significant amount of illness, both at the student level and in the faculty level. Are we trying to mix apples and oranges by saying daycare with low spread is going to have a behavioral relationship to high school or middle school students? That, you know, they're not in bassinets in high school. In childcare, they're literally in bassinets at some ages.
Yeah, no, I don't think you can generalize what we learned about childcare, and I don't think this was a perfect study. As much as I deeply respect the people who did it, you know, I think it was a very short period of observation. Really, only about 2 weeks of the period of observation was a period in which we had much community spread in Rhode Island. So that's a limit. When, you know, one of the other interesting things about this was in the process of this, according to the rules they used, they were working with about 18,000, almost 19,000 kids, but not 850 of those kids and staff needed to be isolated or needed to be quarantined in the course of just 2 months. So, you know, even with these strict rules, there was a fair amount of disruption from disease. And the other thing is when they isolated people, or when they quarantined people, they didn't test all the contacts. So if you were to go into quarantine, you only got tested if you were symptomatic. And to me, that suggests that we may have missed a fair number of people who got the virus but didn't show symptoms, which is a common situation in small children. And there was no weekly testing of staff. So a couple of the things that we might have used to really get our handle on how much disease were present, we really didn't have the chance to use in this study.
Dr. Fine, thank you. One quick thing before we let you go, and I really appreciate you taking the time to jump back on this special report. is Rhode Island numbers came out today after we chatted at lunchtime. 7,200 tests and 130 new cases. The day before, tests were at 2,800. We've got a call into the Department of Health asking for clarification. I know they're bringing some new things on. We're already getting complaints about the new testing apparatus that is being implemented. What's going on? 2,800 one day, 7,200 the next day, both weekdays in the middle of the same week?
Well, you know, I've always said you can't get too excited about one day in isolation. I'm guessing, and this is just a guess, that they're bringing some new technology online, and that some of that technology didn't work from a reporting perspective, at least. And what we're looking at today is sort of catch-up data from previous days. I don't have any way to know that for sure, but you know, I've never seen us come close to 7,000 tests. So that suggests to me what we're seeing today is the reporting of a number of tests from earlier in the week that didn't get reported in a timely way.
Yeah, we'll try and get clarification on this from the Department of Health. We've got a call into them, and you know, the last couple of weeks, the numbers have been just all over the place, and lots of questions about the reporting. Dr. Fine, thank you so much. Anything else people need to know going into the weekend?
Nope, just, you know, if there was one additional take home that I got from Dr. Redfield, it is, you know, keep masking, keep social distancing, adhere to all the CDC's mitigation steps, and we all need to do everything we can to drive community transmission as low as it is possible to get it, and that's going to take all of us together.
Dr. Michael Fine, thank you so much for this special segment. Everyone else, please stay safe. Look for updates on GoLocal. A story just broke. What Mayor Lorza had to say about the shootings after a couple weeks of silence, five murders in 2 weeks in Providence. But what also community leaders had to say. Cedric Huntley from Nonviolent Institute, who said, listen, this isn't a police problem. This is a community problem. These shootings didn't take place by police officers. They took place by folks in the community against other folks in the community. So interesting read, also video included in that, thanks to Latino Public Radio and our friend Ronaldo Almonte. Thanks everyone, stay safe and look for more updates. I'm Josh Fenton. Please, please wear your mask.
Thanks, Josh.